What does diastolic hypertension mean? Having high diastolic blood pressure is a sign that your blood vessels have become less elastic, hardened, and scarred. Blood pressure is not a static reading as it tends to fluctuate throughout the day, with the normal rate of diastolic blood pressure ranging between 60 to 80 millimeters of mercury. Having flexible blood vessels allows your body to appropriately manage oscillations in blood pressure. However, when your blood vessels are rigid, the chances of vessel rupture or obstruction is more likely to occur. Diastolic hypertension versus systolic hypertension. For decades, it was assumed that diastolic hypertension, an increase in the bottom number of blood pressure readings, was a more concerning finding than systolic hypertension. However, this thinking has now changed, as systolic blood pressure has been found to play a more significant role in the development of various blood pressure complications such as stroke and left ventricular hypertrophy. A recent study assessing cardiovascular risk in treated hypertensive men found that the control of systolic blood pressure was more important for overall survival, with diastolic blood pressure having little value for predicting future cardiovascular risk. Also read, what causes systolic hypertension? Causes and risk factors for diastolic hypertension. There are several causes of high diastolic blood pressure, with a diastolic reading of greater than 90 millimeters of mercury and above considered high. The following are some of the most common high diastolic blood pressure causes. Primary hypertension. This type refers to a state of high blood pressure that is not attributed to a known disease cause, such as stiff or hardened blood vessels. It is believed that primary hypertension manifests due to a combination of genes and environmental factors, with many common genetic variants being responsible for its development having been identified. Having isolated diastolic hypertension is primarily seen in young adults and is not seen to be attributed to any particular cause, but may be due to endocrine hormone imbalances or inappropriate contraction of tiny blood vessel wall muscles. Endocrine and kidney causes. The endocrine system is composed of a collection of glands that secrete hormones directly into the circulatory system. These hormones are able to target distant organs, helping to regulate physiology and behavior. The thyroid gland is one of these endocrine structures, and it can produce abnormal levels of hormones that lead to elevations of diastolic blood pressure. Problems with the kidney, such as renal failure, are also a common reason for blood pressure increases. Obstructive sleep apnea, a condition characterized by repeated episodes of breathing cessation during a single night. It is believed that because most sleep apnea patients are obese, this also translates to increased blood pressure, but some studies have shown that high blood pressure in these patients can occur regardless of obesity. Obesity. Carrying extra fat on the body acts as a surface area on the body that your heart has to pump blood extra hard for it to fully reach it, leading to increases in blood pressure. Additionally, extra fat in the form of cholesterol can become deposited along the walls of the arteries, causing them to become narrower. Poor diets consuming foods high in fat and salt can lead to increases in blood pressure and even damage blood vessels. Smoking and alcohol. The nicotine found in cigarette smoke is known to be able to constrict blood vessels, increasing heart rate, and decreasing the levels of oxygen to the heart. The consumption of alcohol can indirectly lead to high blood pressure as they are often high in calories, which can lead to weight gain. Sedentary lifestyles. Not exercising the body on a regular basis can lead to a number of illnesses related to weight gain and increased cholesterol levels. Age and gender. Getting older is considered one of the most common contributing factors for the development of high blood pressure for both men and women. However, men over the age of 45 are considered to have a high risk of developing high blood pressure-related problems. Women in comparison average about 55 years old before they begin to have health-related issues related to high blood pressure. Race and ethnicity. African Americans are considered to have a higher risk of developing high blood pressure compared to Caucasians and other ethnicities. It is estimated that about 40% of African American men and women have high blood pressure. Complications of high diastolic blood pressure. While much emphasis is placed on reducing systolic blood pressure values, elevations in diastolic blood pressure is still a significant predictor of life-threatening consequences. A previous study evaluating the medical records of over 1 million people reported that while elevations in systolic blood pressure were indeed linked to a higher risk of heart disease-related chest pain as well as strokes, high diastolic blood pressure was linked to a great risk of abdominal aortic aneurysm, a condition where the main artery found the abdominal cavity leaks or bursts, creating a life-threatening situation. Additionally, other studies found that a link between increases in diastolic blood pressure and cognitive decline. Isolated diastolic hypertension can possibly lead to possible progression of systolic hypertension, of which is a predictor of diabetes, stroke, and heart failure.